There's a lot that goes on around here that sometimes I don't even think about, but the girls are on top of it, especially doorknobs and things that are touched a lot. So all those things have to be clean. Patient rooms have to be extra clean. So we're hoping this gets over with pretty soon so everybody can go back to work.
I'd like to introduce Dr. David Patton.
I think we're doing what most offices are doing, is giving the patients the option of waiting in their cars. And I would say most patients do wait in their cars versus separating themselves in the waiting room. That way we can just bring people straight back to their rooms. You know, as a OBGYN provider, still lots of people having babies, so they have to be seen. So getting their temperatures taken at the door, have to answer a questionnaire, trying to do our part to prevent anybody getting it here at the office. All in all, you know, we're hoping that we're reaching a peak here in West Virginia and we'll be on the downhill slide, and hopefully we won't have a resurgence of it when people go back to work. Guess we'll know those things when people do go back to work. We'll also know a lot more when they start doing antibody testing on finding out how many people who have already actually had the disease. And it looks like it's a lot more people who have had it than we've thought in studies out of California and I hear Michigan also. Well, so far it's been really rare to have anything at CAMC, especially at Women and Children's. I don't know how many cases specifically they've had at Women and Children's. I think, if any, that you could, I would say you could count them on one hand, and then maybe they've had none. I haven't heard of any for sure yet over at Women and Children's. I certainly haven't had any positive patients yet. You know, the hospital's doing their part too. The entire hospital won't allow visitors except for one parent if it's a pediatric patient, and then the husband or other designated person can come in with a laboring patient. Sometimes I think that becomes a more intimate setting for delivery. I think that patients may like that maybe more than they admit, because sometimes it's a lot of pressure when you've got 20 family members waiting in the waiting room. So in some ways I think it's kind of nice, but I do know that they miss having, you know, husband and mom there, or so it's tough. But all in all, I think the patients have had a good experience and things have gone well so far at Women and Children's. Well, fortunately so far, we've had no problems with patients getting sick, and certainly we haven't had any babies getting sick. But all in all, still having a baby at Women and Children's is a safe experience. The nurses are prepared, doctors are prepared, the hospital itself is prepared for what's happening. I don't think people should be afraid to come in and be seen at the hospital, have their baby, and because it's been an overall great experience.